Hi, everyone. Thank you for having me at the Purple Day Around the World Virtual Epilepsy Education Conference. As most of you may already know, epilepsy knows no borders or boundaries. Epilepsy is not a choice, but ignorance and stigma are. My name is Kim Davidson, and I am joining you today from Vancouver, Canada, to speak to you about advocacy and the international I'm a Voice for Epilepsy awareness campaign that I founded. Tonight, I would like to share a few words about my journey as a patient advocate. On this day, Purple Day, March 26th, our global community of 65 million are acknowledged by continents, countries, and communities from around the world. Epilepsy is an invisible disease, but on this day, you have visible representation in the media worldwide. It is your day, and it is our day. At the 73rd Annual Health Assembly in November of 2020, 4 months ago, during a global pandemic, the World Health Organization recognized that neurological disorders, including epilepsy, are the leading cause of disability and the second leading cause of death worldwide. In addition, also in November of 2020, the director of non-communicable diseases in Sierra Leone's Ministry of Health and Sanitation announced it planned to make epilepsy a national health priority. Canada has not done what Sierra Leone has done. In Canada, there is no national strategy to address epilepsy. Universal health care in Canada is not universal for all Canadians, and especially those that are living with adult epilepsy in British Columbia, where I live. Sadly, we do not have access to the same resources, medications, diagnostics, treatments, therapies, surgeries that are seen in all other parts of Canada. So, tell me, do you know the difference between apathy and ignorance? Well, apathy means I don't care. And ignorance is I don't know. So there's no public service announcements to educate Canadians about seizure first aid or epilepsy. And I'm advocating this to change across Canada, to move from ignorant to being informed, and from apathy to empathy. As citizens of the world, we can work to reform, inform, educate, and advocate for epilepsy populations in innovative ways. And once an apathetic government becomes empathetic, they will know better, so they have to do better. So there are ways to impact systemic change within healthcare systems and government. And I urge you to sound the alarm and expose the truth in order to save lives. Here are some innovative strategies for you to consider doing. Launch a petition as a tool to inform, educate, and advocate for more funding for programs, services, equitable standards of care for people living with epilepsy in your community and country. For example, we launched End the Epilepsy Crisis in British Columbia. We did a petition, and that has been signed by thousands, including patients, families, neurologists, and community partners. Conduct surveys to learn what is and what is not working for people living with epilepsy in your community and country. For example, we did a survey to find out the effect of COVID-19 pandemic on epilepsy, seizures, and mental health. We also did a report card survey on British Columbia's adult epilepsy system, where the province received a failing grade, an F. And the failure told us what we already knew. We knew that we had a failing system where I live. You can write letters to your politicians at all levels of government. Request meetings to collaborate and find ways to work together to address the shortcomings of epilepsy programs within your healthcare system. Become members of local epilepsy organizations. Consider joining the board of directors to ensure that there's lived experience at the table. The lived experience needs to be represented in determining the priorities of these charities worldwide. While I was waiting to meet with my government, people living with epilepsy continued to die. And the provincial government was complicit in allowing the adult epilepsy crisis to continue. To highlight this lack of action and leadership, I created the What If documentary series and included over a dozen unsuccessful attempts to meet with government over a period of 26 months. I moved from being a health charity CEO to the creator, executive producer, and director of the What If docuseries. Innovative ways of trying to raise awareness and get the attention of government to make systemic changes. In 2020, over the course of 2 months and during a pandemic in October and during British Columbia's provincial election, and in November, 4 episodes of the What If docuseries were released. Episode 1, Failure, the Black Mark in Canadian Healthcare. Episode 2, Prisoner of Purgatory, the Jared Ricks story. Episode 3, Unashamed and Unafraid, the Alison Hedgedas story. And episode 4, Jesus Loves Me, the Mackenzie McWilliams story. Collectively, our docuseries has over 150,000 views, and I believe that our work is creating a movement. Again, we were able to accomplish all of this in 2020 during a pandemic, and imagine what we'll be able to do once this pandemic is over. We will be producing another 3 documentaries in 2021. There's an opportunity for all of us to aspire to inspire our people. We need to work together, plan together, and lead the patient voice together. The Epilepsy Association reaches millions each month in over 150 countries with epilepsy news, education, and support. And we are so proud to work alongside Chuck Carmen. Chuck is a guiding light and truly exemplifies what partnership and collaboration really means. He was our first American partner, and through him, we were introduced to Deb Josephs of the Anita Kaufman Foundation, who then became another partner for us. Deb is a powerhouse and is an awesome advocate and networker. It is important for us as leaders working within epilepsy to join forces and create a global community. We want to unite voices and be the agent of change and accountability. We need to leverage our relationships and organizations for more research, better policies, improved services, and increased education on epilepsy and seizures. We know we have people in leadership positions in all of the corporate executive domains, in sports and the entertainment world, who have not self-identified as having epilepsy. We need these people to step out and be champions for the cause. Within the epilepsy community, we need that kind of leadership and representation of politicians, corporate figureheads, policymakers, medical staff, to help guide us and guide the patient voice through health and education, law, social services, and human rights. Ideally, people living with epilepsy will inform decision-making, have equity and justice, and be part of social support systems without stigma wherever they may live. With true collaboration, we have unlimited potential. I encourage everyone who is watching this to reach out to me, to Deb, or to Chuck to find out ways in which you can become engaged and participate in our campaigns. Thank you for having me, and have a great Purple Day.